I'm an esophageal and gastric surgeon. I've had a special interest in esophageal diseases and gastric diseases for about 25 years. My whole focus is on anything that occurs from the pharynx down to the duodenum. Achalasia in particular has been a special interest of mine, and I've carried out over 400 procedures on achalasia patients. For normal swallowing to function, you have to have a number of things working well together in coordination. The esophageal body is a muscle, and it contracts from the top down, and it propels the food through. You're not actually in health depending on gravity, you're depending on the push of the esophageal muscle pushing that food bolus through your esophagus. It's also dependent on the sphincter, which is the little valve at the lower end of the esophagus opening up.
In a healthy esophagus, the tube that carries food to your stomach, a set of muscles that contract and relax in sequence, move drinks and chewed food, called a bolus, towards the stomach. This movement is called peristalsis. The lower esophageal sphincter, or LOS, is a set of muscles that relaxes once peristalsis happens to allow food into the stomach. When the food has gone in, the LOS closes to prevent stomach acid rising back up. It takes about 2 to 3 seconds for the food leaving your mouth to arrive into your stomach. The muscles are so strong that they can move food to your stomach, even if you're upside down.
In achalasia, there is a disruption to the normal function of the nerves that control this. So when you take your swallow, the esophageal muscle does not contract in a coordinated way from top down. It contracts in an uncoordinated way, sometimes the lower bit first, sometimes all of it together, sometimes simultaneously. Also in achalasia, the lower esophageal sphincter remains closed, and it doesn't just remain closed, it remains at a high pressure. The consequence of this is that food will sit above the sphincter and not pass through, and that's essentially what's happening in achalasia.
Achalasia is a disorder where the muscles in the esophagus don't work correctly. Instead of the muscles tightening and relaxing in the right order, peristalsis, with achalasia the muscles are weak, don't tighten and relax in the right way, or they simply don't work at all. At the same time, the lower esophageal sphincter does not relax and open correctly, meaning that food cannot easily reach the stomach. Food can then start piling up in the esophagus like water in a hosepipe when the end is blocked. In someone with achalasia, it can take hours for the food to travel to the stomach, and sometimes it stays stuck in the esophagus for days. Achalasia is a rare condition, with only about 1 in 100,000 people being diagnosed each year. In the UK, around 6,000 people are living with the condition.
At night time, I would have a drink of water, and I'd sort of lay down, and about a minute or so later, I suddenly hear the water going down, gurgling down. I thought, that's strange. But I went to see the doctor. He sent me for an endoscopy. They didn't discover anything. I was finding it more and more difficult to eat, because when I did eat, it would just lay on my chest. Then I got to the point where I would eat, and then it wouldn't stay down. It would just come back up. I went from about 9'10" down to 7 stone 2 in about 6 months.
Sometimes, and last night was a good example of this, my lower esophageal sphincter just closes up and it says nothing's coming through. So I got halfway through my dinner last night and that was me done.
And so it makes socialising more of a difficulty. We get by, but I can't so easily go out to a restaurant. I have to find the right kind of restaurant with the right kind of food. And I don't want to talk too much while I'm eating.
Achalasia affects the esophagus and causes a non-relaxing lower esophageal sphincter, or LOS, weak muscle contractions in the esophagus, simultaneous and/or badly coordinated muscle contractions in the esophagus, simultaneous areas of high and low pressure in the esophagus without relaxation of the LOS, the esophagus changing shape and being stretched by the weight of stuck food, irritation, inflammation, or infection of the lower esophagus, mainly the lining or mucosa. Because of the effect that achalasia has on the esophagus, people with achalasia may experience pain from stuck food, regurgitating food and saliva, chest pain from spasms, losing too much weight, malnutrition, pneumonia and other respiratory problems caused by inhaling food, acid reflux, fatigue or tiredness, anxiety, a weak and fatigued voice.
When I started to get back spasms, at the time I thought they were just tension in the muscles in the back. And my wife was a masseuse, she worked a lot and it didn't make an awful lot of difference. And I started to have periods where, particularly at night time, I'd wake up not being able to breathe. I'd get stuff that I'd refluxed. And then I would have trouble breathing and I'd have to sit up in bed and force air out of my lungs in order to get myself breathing again. A couple of times I was having a meal. The first time was actually in a public place with a lot of people. And I had an instant reflux of food up through, and it came out of my nose, which was spontaneous and very unexpected and disturbing. And it happened a couple of times, and I thought I'd better go to the doctor with these things.
I was just sat at the table with my parents. I was 17 at the time, so final year of school. One day I was just swallowed and I had that feeling. And I was like, oh, it's strange, I might have just eaten too fast. And then it happened again, and it kept on happening at every mealtime. And I think after a week, I told my parents. The GP diagnosed me with a sort of eating disorder. So that for me was quite difficult to be told you can't eat because of something psychological, whilst I felt that that wasn't true. I did feel very confused.
The spasms, which I get two varieties of those. One is these, where everything's just shut, and other than a little bit of discomfort, it's fine. And the other one, if you imagine a cramp in your hamstring, it feels like that in the middle of your chest. I woke up thinking I was having a heart attack, and it was just absolutely excruciating pain. First time I'd experienced it as well.
Spasms can affect people in different parts of the torso, the chest area, but for me it was principally on the back. And it felt like something was clamped across the centre of the thoracic spine, and it would last for hours. And often at night, and it would be very, very uncomfortable.
It's very difficult to tell when you might get spasms, maybe certain types of food as well, so like the skin of grapes, so I don't eat grapes anymore. That was again an Achalasia Action member who told me to not eat grapes, and that actually changed my life. I got way fewer spasms from not eating grapes.
Although there isn't a cure, what we can do is overcome the barriers put up to normal eating and swallowing by achalasia. And we can allow patients to feel like they're swallowing adequately and to have a normal diet and to get on with their lives. Achalasia patients have symptoms for a median of 6 to 7 years. The clinicians would not necessarily pick up these symptoms as being those of achalasia.